Welcome to Asian News. I am Dr. Krishna Puttaparthi. Today we get to interview a doctor who is a Padma Shri awardee, Chief Academic Officer, Apollo Hospitals, Director, Apollo Institute for Blood Pressure Management and Professor, Apollo Medical College, Director, World Hypertension League, South Asian Region, Hyderabad, India. And also he is a Professor of Clinical Medicine, University of Texas Southwestern Medical Center, Director of Texas Blood Pressure Institute, Dallas, Texas, USA, and Dean of Macquarie University Medical School, Sydney, Australia, India campus. He is none other than Dr. C.Venkata S.Ram. Welcome, Dr. Venkatram, to iAsia News.
Thank you very much, Dr. Puttaparthi garu.
Dr. Venkatram, many people ask, what is hypertension? And again, it is the same as high blood pressure. Would you please clarify?
Thank you, Dr. Puttaparthi garu, for asking me to participate in this dialogue about a very common problem in the community all over the world, namely high blood pressure. High blood pressure is also known as hypertension. So when people say that he or she has hypertension, it means that person has high blood pressure. Hypertension has nothing to do with mental tension. That is just the word. Hypertension means blood pressure is high. That is hypertension. So when people say high blood pressure or hypertension, it is the same thing, no difference.
Why is hypertension or high blood pressure called as a silent killer?
High blood pressure is the most common reason for heart attacks, for strokes, and for kidney failure all over the world. Number one cause of chronic illness from brain, heart, or kidney is hypertension or high blood pressure. Unfortunately, high blood pressure does not cause any symptoms for a long period of time. And by the time it causes any symptoms, such as heart disease, kidney disease, or brain disease, it's too late. So there is a long period during which high blood pressure remains as high blood pressure without causing any damage. But it is silently causing damage to brain, heart, and the kidney. That is the reason it is called silent killer, because during the initial stages, there are no symptoms. Patient does not feel anything different until it is too late. And that is the reason why all over the world, it is known as silent killer.
So what are the hazards and the health risks from this hypertension? Can you explain a little bit?
Sure. Whenever the blood pressure goes up in the circulation, it is just like pressure that goes up in a water tap. When the pressure goes up in the circulation, it can cause clotting of the blood, or the blood vessel can rupture. Whenever there is clotting of the blood or blood vessel rupture, if it is in the brain, it can cause paralysis. If it is in the heart, it causes heart attack. If it is in the kidney, it causes what is known as chronic kidney disease that ultimately might require dialysis or kidney transplantation.
So for a common man, for a layman, what are the consequences of this high blood pressure if it is not controlled?
When blood pressure is not normal, and if it stays high for a long period of time, there is a significant damage that occurs within the body. There are guidelines for treating high blood pressure all over the world, every country all over the world. There are set of guidelines on how to diagnose and how to treat it. There are certain set of numbers which are considered normal, and anything higher than this is called abnormal, and that is hypertension. So based upon the number of blood pressure, the top number or the bottom number. The top number is generally called systolic when the heart is contracting. The bottom number is called diastolic when the heart is relaxing. So to know your blood pressure, you should know both the top number as well as the bottom number.
See, whenever you go to the doctor, first thing they ask you to go check the blood pressure. What exactly they're checking? Are there any numbers or anything? I mean, how can they say that you have you have a high blood pressure?
Yeah.
Can you tell the numbers, sir?
Yeah. One of the things that fortunately is very easy to measure and very inexpensive to measure is the blood pressure. They can put the blood pressure cuff on the arm, and there are some new automatic devices also. And by measuring the blood pressure in the arm, you have an estimate if the blood pressure is high in the body. So arm is just a part of the body that suggests if the blood pressure is high in the whole body. So when the doctor or the nurse or any healthcare provider measures the blood pressure, there are two sets of numbers that are either heard or that are recorded automatically if it is a digital machine. So the usual normal blood pressure at the present time, as we are entering 2026, is 130 top number, bottom number is 80. There is a world consensus that the normal blood pressure should be 130 by 80 or less. Until recently, the normal blood pressure used to be a little bit higher, namely 140 by 90. But now we know that people who have blood pressure between 130 to 140 are at high risk, and patients who have a blood pressure between 80 and 90 are at high risk. Therefore, there is a universal consensus that the normal blood pressure in every person should be less than 130 by 80. So that is the definition of normal blood pressure. Anything higher than that is called high BP or hypertension.
Okay, you said these numbers, right? And then let's say that if a kid goes to a doctor, whatever the reason, and an adult goes to doctor, is it that they're looking for the same numbers, I mean the blood pressure, or is it something different they're looking for?
Okay, so the blood pressure values that I talked about, those numbers are for adults, namely 18 years or older. For children, there is no absolute normal blood pressure because you cannot do research in children.
Okay.
So the way they do is, out of 100 children, 95% of children have a blood pressure within that range. If the blood pressure is not within that range, namely 5%, that is called high blood pressure.
Yeah.
So in children, a majority of them have a blood pressure under some value. If some children have a value that is higher than that, that is abnormal. So it's not an absolute number, but it depends on what majority of children have blood pressure in that age group.
Let me ask you, because you said the numbers now because of the younger kids and the adults, you see anything, same thing like an adults in the younger group also?
No, I think younger group, very young people we do not know because usually blood pressure is not measured unless a child is sick. In most children, irrespective of the gender or weight or physical activity, in most children, the blood pressure is in the range of 110 by 60. Top number 110, bottom number 60. That is the range in which the blood pressure should be in most children.
Dr. Ram, for some people, they complain that when they go to a doctor's office, their blood pressure is high. And the same people, they say, no, when I checked at my home, my blood pressure is normal. Why is that whenever I go to a doctor's office, my blood pressure is high, and they say that you have high blood pressure? Why is that?
Not all, but there are some people who become anxious when they go to a doctor's office.
Okay.
Because they're afraid that the doctor might find out a condition that they're not aware of it. So there is a degree of so-called subliminal anxiety in some people when they go to a hospital or a doctor. And when the blood pressure is measured by a doctor, such a person gets more nervous. So the blood pressure might go up in the doctor's office or clinic, whereas the same person, when he or she takes the blood pressure at home with any of the automatic devices, the blood pressure is normal. So this condition where the blood pressure is high only in the doctor's office or hospital is known as white coat hypertension. These days, not all doctors wear white coat, but once upon a time it was very uniform that practicing doctors would wear white coat. So that is the reason why it is called white coat hypertension. When the blood pressure is high in the hospital or the doctor's office, but normal at home, and that is called white coat hypertension. And usually, this kind of so-called office or white coat hypertension is not immediately treated. Such individuals are followed periodically to see if they really have high blood pressure or not, and there is no reason to panic if you have white coat hypertension.
Is the high risk of this BP, is it same thing for the women and the men, or is it something different?
Yeah, for a long time, maybe even for 100 years or so, it was felt that women in general are at a lower risk of developing high blood pressure or heart disease. But this concept is completely changed now, has been proven to be false. The current knowledge that we have, based upon so many clinical research studies in various communities, suggests both men and women are at the same risk of developing high blood pressure or cardiovascular disease. So the previous notion that women have natural protection from these conditions is incorrect. At the present time, does not matter your age, your gender, you're at the same risk of developing high blood pressure if you're destined to develop it.
Let's say I go to a doctor, or if I don't go to a doctor, how do I know that any symptom that I have a blood pressure?
The only way that you know whether you have high blood pressure or not is to have it measured, because as I mentioned in the earlier, that it has no symptoms. So when it has no symptoms, you will not know whether you have the condition unless the blood pressure is measured. It is not like fever, for example, or headache. Then you know that you have fever or headache. But this is very silent. So you can have the blood pressure measured at so many public places now. There are self-measuring automatic blood pressure kiosks. And most of these kiosks are very reliable and they're dependable. So if you want to have your blood pressure taken casually, any of the blood pressure measuring devices that are there in pharmacies or in hotel lobbies or hospital lobbies, you can have it measured. If it is high, then it has to be confirmed by a medical facility, by a doctor or a nurse. So whatever blood pressure you get yourself by a kiosk, it is only a screening test, not diagnostic. You will have to have it confirmed by regular measurement of blood pressure by a physician or a physician assistant or a nurse.
Nowadays, I see that people bring the digital one, which at home they can check their own blood pressure. How reliable they are?
Yeah, it's a very good question, because there was a period of time, let us say until 10 years ago, where the digital blood pressure measurement devices were not regulated. So when those machines were manufactured, there was no precise regulation how it should be manufactured. But at the present time, all the medical devices, including blood pressure measurement devices, there are universal global standards for medical instrumentation. So every blood pressure monitor that is marketed has undergone initial tests to make sure they're accurate according to the societies which oversee medical instrumentation. So in general, any blood pressure machine that you use by yourself is likely to be reliable unless proven otherwise.
That means even though you check it at home, it is still you recommend that they go to their doctor and get it checked, so that they don't have blood pressure or they do have blood pressure.
Yeah, I think if you have home blood pressure is abnormal, it has to be confirmed in a medical facility, because this is a medical condition and you don't treat it verbally over the phone unless a medical person, the nurse, physician assistant or doctor examines you, because once you have high blood pressure, you have to undergo full physical examination to make sure that your body systems are working properly, and you need a clinical examination that requires to validate the significance of blood pressure that you have obtained at home.
Is there any way to control the BP and make it a normal, or is
When the BP is abnormal, usually it has to be repeated after 2 to 3 weeks to make sure that it is consistent. If it becomes normal, then there is no need for further action. But if high BP is confirmed on repeated measurements, then the BP has to be controlled to normal limits. And I have already mentioned what the normal limits are. And the usual step that is taken for the initial treatment of high blood pressure is to change the lifestyle changes, namely changing the diet to a low salt diet, regular physical activity, avoidance of excessive alcohol, and normal body weight, physical activity, and avoidance of stress if possible. And this is what is recommended for about 2 to 3 months. If the so-called lifestyle changes are not possible, or if the lifestyle changes do not reduce the blood pressure, then there are so many blood pressure medications that are available that your doctor will use to reduce the blood pressure to normal limits, and that can be done without much difficulty at the present time.
how can you treat the high blood pressure with or without the medicine?
Okay, first I mentioned earlier, unless the blood pressure is very high, extremely high, the best way initially for all patients to change the lifestyle if possible, increase your physical activity, attain normal body weight, and then regular physical activity and moderation in salt intake and moderation in alcohol intake and discontinuation, stoppage of tobacco consumption. This is very standard approach for initial management, treatment of high blood pressure. If after 2 to 3 months of this so-called lifestyle changes, the blood pressure remains high, then the doctor has at his or her disposal a large number of very effective and safe medications that can be given as a single pill or in combination to make the blood pressure normal, and they can do that without much difficulty at the present time.
Say, if a patient goes to doctor, then you diagnose that he has a blood pressure, high blood pressure. So you prescribe some medicine. Is that like a lifelong treatment, or is it only few months? So how?
Yeah. This is a question that a lot of people ask, and a lot of people have some kind of a fear that whether you need to take medications lifelong for high blood pressure. Because high blood pressure is always a lifelong condition, it has to be made normal lifelong. And if you are taking medications, it is always for indefinite period of time. It could be lifelong, and there is nothing wrong with it. Because if your blood pressure is normal with medications, it is as good as having normal blood pressure. And if you have normal blood pressure with help from blood pressure medicines, there is nothing wrong with it. In fact, the longer you take any measures to control your BP, the longer you're likely to live.
Dr. Ram, anyway, you prescribe this one, the medicine for the blood pressure. So, what are the actually good medicines for this blood pressure to make it normal? Let's assume I take the medicine, and what are the side effects of that treatment?
This is a very common question and a quite legitimate question on behalf of patients and their families, whether the blood pressure medications can cause side effects, although the blood pressure is reduced. The modern medications which are available now, most of them are free of side effects. Some of the older medicines, which are still available by the time, would have caused some side effects such as weakness, fatigue, or loss of sleep, etc. But with the current generation of so-called new crop of blood pressure medicines, even at high doses, one should not experience any side effects, which would have happened with older medications.
Okay, Dr. Ram, I have the blood pressure machine at home. Do I have to check 24 hours if I have a blood pressure, or is it only, or in a little bit longer?
In some individuals, when they take the blood pressure at home, they get different readings on different days. And they get different readings at different times of the day. And their concern is when the blood pressure is changing so much within a day, which is the number that has to be followed. So when the blood pressure is fluctuating that much, there is a technique called 24-hour blood pressure measurement device. You can have your blood pressure measured with an automatic device over a 24-hour period. It is just like a blood pressure cuff. It is hooked to the arm, and there is a machine that is hooked to the blood pressure cuff that takes the blood pressure continuously for 24 hours. And after the 24 hours, your doctor can analyze based upon the number of readings whether you have high blood pressure over a period of time that requires treatment, or the blood pressure is fluctuating and most of the numbers are normal, then you don't have to be treated at that point in time.
Oh, he has a cardiac arrest. Cardiac arrest. What exactly the cardiac arrest? Can you tell the viewers?
In the community setting, often you hear of somebody having cardiac arrest. In most cases, unfortunately, cardiac arrest is fatal. That means the person will not survive. Very few people will survive from a cardiac arrest. Cardiac arrest means when the heart is beating normally, it requires blood flow to the heart. Although the heart is the one that pumps the blood, it also requires the blood for it to pump. So when the blood supply to the heart is blocked, then suddenly the heart gets a jolt. If the blood supply does not become normal quickly, then the entire heart will stop beating, and that is what is known as a cardiac arrest. Basically, the heart is arrested since it is not able to pump normally. So when the blood supply to the heart is cut off due to any disease, then you are at a high risk of developing cardiac arrest. Cardiac arrest for a layperson is when the heart stops breathing, stops beating at that moment.
So what causes is that the cardiac arrest? Is that because of the heart doesn't get the proper blood supply, or is that
occurs when the blood supply is not sufficient for the heart to keep pumping. And many individuals who develop a cardiac arrest do develop a chest pain. And if somebody develops chest pain and collapses, it is cardiac arrest, then it should have so far advanced cardiac resuscitation. And they should be resuscitated based upon the facility until the ambulance arrives and provides so-called first aid treatment to stabilize the patient.
I have this question, Dr. Ram. I've seen nowadays people going to the gym and people are playing basketball or any other sport. All of a sudden they collapse.
Yeah,
So why is that? And they're not old. They're only in 30s, maybe in 40s. So what's happening? I mean,
there are many conditions which can cause sudden death, even in people who are physically fit, and even in people who preach physical fitness. They are also at a risk of sudden death. The exact cause is not known. So, what is presumed, this is also known as, in the medical language, this is known as athlete's heart.
okay.
Athlete's heart, it is seemingly normal, but actually it is not normal. There is one point where the blood supply to the heart is shut off, even when you're exercising, and then you collapse. So this is really unfortunate, and there are some people who have serious complications while doing physical activity. But it does not mean one should not do physical activity. But this is a syndrome called athlete's heart, and there is a suspicion that they're genetically predisposed
Okay.
to develop a heart attack. So there is a genetic basis that some people might have, and you have no control that you have a genetic problem. So this could be so-called genetic. In medical terms, they use the word cardiomyopathy. So there could be genetic predisposition that can create cardiac problems even in people who are physically fit, who follow all the healthy rules and regulations, but a small percentage, but it can happen.
Thank you, Dr. Ram. There's another question I have, or even any, a lot of people ask, don't eat, he's eating a lot of salt, that's why he has some problem. Is that anything to do with the salt and to the heart problems?
The salt, if it is consumed excessively, puts more pressure on the heart and it can increase the blood pressure. The recommendations for the salt now by World Health Organization should be less than 2,400 milligram per day, namely less than 2.5 grams per day. Many individuals in a free society consume salt that is 6 to 8 or 10 grams, much higher. So the recommendation would be to restrict the salt to less than 2,400 milligram per day. What it means is the total salt that you use in a day should not be more than 1 tablespoonful in the cooking, etc. And one should avoid table salt. So it's not that difficult because you use less salt in cooking and you don't add salt on the cooked food. That automatically reduces to less than 2,400 milligram per day. You don't need too many measurements. It's very, very simple.
Dr. Ram, nowadays when you go to the doctor, you give the blood for checking the cholesterol. What exactly this cholesterol is related to your heart disease?
Cholesterol, like blood pressure, like diabetes, like increased body weight, is a risk factor for heart disease. Namely, it can also have a negative effect on blood circulation. When cholesterol level goes up in the blood vessels, then the circulation is impeded. So the blood will not flow easily due to cholesterol build-up in the blood vessels. So if the cholesterol is beyond a certain number and is not corrected, it can cause blockage of the arteries, which also results almost in the same complications as high blood pressure. So like blood pressure, there are values for cholesterol which are normal, which are abnormal. But one thing different between blood pressure and blood cholesterol is blood cholesterol generally does not fluctuate that much. So once you have a blood cholesterol done, that is the real cholesterol.
Okay.
You don't have to have it repeatedly done. Same thing with blood sugar for diabetes. It does not fluctuate that much. If your blood sugar is high, it is definitely high. You don't have to have it rechecked at the same sitting. So high cholesterol, like high blood pressure, by causing blockage of the circulation, can cause almost the same complications. In many people, high blood pressure and high cholesterol occur together as companions, and these are inherited together. If you have high blood pressure, you're at a high risk of developing high cholesterol, and vice versa. If you have high blood pressure and high cholesterol, you're also at a high risk of developing diabetes. You may already have diabetes unless you have checked it. So all these things, blood pressure, blood cholesterol, blood sugar, all of these have to be maintained in normal limits. Any abnormality that is not corrected can cause harm to the body in the long run, not immediately, but in the long run.
One more thing, Dr. Ram, that people they say that he's obese. Is obesity is anything to do with heart problems, or is okay if you have obese, no problem?
Yeah, obesity by itself is one risk factor because the larger the body mass, greater is the load on the heart. So when you have a heavy weight, the same high load is put on the heart, and you're at a risk for heart disease. Another reason for people who are unfortunately above normal weight or obesity, due to their weight, they are not able to be physically active. So along with obesity, the level of physical activity also goes down, and you develop what is called a sedentary lifestyle. When the lifestyle is sedentary, that means there's not much body movement. That can also cause significant problems with circulation and heart disease.
Well, Dr. Ram, you have given so many questions answered now. What is the last thing that you can tell our viewers that, to have a good life and without any blood pressure or any hypertension?
Obviously, there are fundamentals, so-called in medical field, they call that fundamentals rules for individual health, for community health, and for public health in the country. There are normal standards for body weight depending on your age and height, and you should maintain that normal body weight, namely body mass index. People call it BMI. They're the standards for women, men, ages. You should remain in that BMI as much as possible. All individuals should have some degree of regular physical activities. Even 15 to 20 minutes of brisk walking is considered a good exercise. But if you want to go to gymnasium, that's fine also. And then excessive consumption of salt should be reduced. Salt should not be cut out completely. That is not good. We're only talking about reducing the salt intake, not eliminating it. If you want, you can use salt substitute. And the other thing about blood pressure, cholesterol and sugar, etc., you need to have your blood tested, and that requires you going to the lab or laboratory coming to you. But in contrast to this, blood pressure can be measured anywhere, and you don't need a laboratory to measure. So anytime you have a chance to have the blood pressure measured in a medical facility or non-medical facility or in a public facility, you should avail of that opportunity. You should never lose that opportunity to have your blood pressure measured very, very easily wherever you are. That is a good screening tool. So my strong recommendation to every person is to know what is your blood pressure. You must know what is your blood pressure. If you know your name, you should also know what is your blood pressure, because that is a part of well-being. So if you do not know your blood pressure, please have it measured, and then if it is high, then there are certain things can be done. If it is normal, it's also a good thing for you to know it is normal. So all individuals can know what is their blood pressure because it is measured very, very easily and there's no laboratory involved. And I strongly recommend, irrespective of your age or gender or activity, you must know what your blood pressure is.
Well, thank you, Dr. Rao. With your busy schedule, still you have given some time to talk about the hypertension or blood pressure. Thank you very much on behalf of IASNS. Thank you, Dr.
Thank you
Rao.
very much for asking me to give some general comments of public health importance, very simple, which can be followed so that you live longer. Once you live longer, then the health of the nation improves, the productivity of the nation improves. Otherwise, it can go down if people are not physically active and contributing to the society at large. Thank you very much.
Thank you.